The World Health Organization has ended their global emergency status for COVID-19 on Friday, saying countries should now manage the virus like other infectious diseases. The World Health Organization's declaration comes just 4 months after China ended its prolonged and severe COVID restrictions after a surge in infections. In many parts of the world, testing has dwindled dramatically, and people have largely stopped wearing masks. To unpack this, we're joined by Foster Mohale, who's a spokesperson for the Department of Health. Foster, thank you for making time for us this afternoon. So the World Health Organization says COVID-19 no longer constitutes a public health emergency of international concern, but this doesn't mean the pandemic is over, right?
That's correct. You're absolutely correct. Thanks, Clement, and good afternoon to your viewers, and thanks for this opportunity once more. Yes, as per the announcement by the World Health Organization regarding the COVID-19 status, what we want to clarify as the Department of Health in the country is that that does not mean the pandemic is over. People continue to test positive in our health facilities, in our laboratories. So we want to urge people that they can still continue to protect themselves against the pandemic. We have got enough vaccine doses in our health facilities, in our depots. So we'll continue to provide vaccination services. But now we've integrated the COVID-19 vaccination services into our primary health services, meaning that we don't have to have a special vaccination sites, just like during the peak of COVID-19. For now, they can just go to the nearest clinic as they go to consult for other health conditions. Then they can also get their vaccination services.
Okay, so on average, how many cases are you reporting recently? And do you still have people being hospitalized due to the virus?
Yeah, the fact of the matter is that so far we don't have people who are hospitalized precisely because of COVID-19, but we still have people who are, we call them the population which is vulnerable. We talk of people who are the elderly people in particular. We talk of people who are living with comorbidities. We talk of HIV, TB, diabetes, and other chronic medications, because their immune system is so compromised, so they can easily suffer from health complications as soon as they test positive. So hence we say, yes, despite the fact that the number of people who test positive is very low, but it's precisely because of two reasons. Number one, people, even if they experience COVID-19 signs and symptoms, they don't come to our facilities for testing in numbers, so which make it difficult for us to record the number of those who test positive. But we'll remember that in some other areas like hospitals, especially private hospitals, at some point they will say before they can get you admitted, you have to conduct COVID-19 tests in order to be sure that they are going to place you in a ward with people who are negative. Otherwise, they will declare you positive. So hence we say we still have got enough doses. People must continue to come and vaccinate, especially those who feel they're vulnerable. It's not a must like before. We've never imposed a mandatory regulation for those people who want to vaccinate or not, but we say people who feel they're vulnerable. And we do get calls from time to time, especially from elderly people, who say, please, where can we get the vaccination to show that they still want to protect themselves at all times?
Yeah, you've mentioned that you have enough doses of these vaccines, but we saw a slow take-up of vaccines in the beginning. Are people taking up that opportunity now? Have you seen a change in the trend?
Currently, truly speaking, Clement, people are not coming in numbers like before, precisely because what we have observed as a country is that people respond quickly when there's a sign of danger, especially during the time of new variants, the times of new waves. So since we were no longer reporting the new wave, the new variants, people are no longer coming to vaccinate in numbers. So there's a low appetite of people to vaccinate. So hence we see people coming in low numbers. Hence we have to shut down some of these dedicated vaccination sites and incorporated the vaccination services into our primary health services in hospitals and clinics.
And in terms of the vaccines that are available, which are they, and are they still in a good condition?
Yes, we've got the two types of vaccine. Currently, we've got about 25 million doses which are available in the country. Out of that 25, we've got about 7 million doses of Pfizer, which has expired by end of April. But you will know that with Pfizer has a short shelf life. But ever since we've been getting extension of shelf life from Pfizer, every time when they expire, they conduct what they call stability study, which is a scientific exercise to extend the shelf life of any medical product. So even this time, they advise that please don't throw or dispose the vaccine that you have. We have applied for extension through the regulator, which is SAPRA. So we are waiting for the final decision, which is due in April. But we still have about 21 million doses of J&J vaccines, which we are currently administering.
Okay. Foster Mohale, thank you for making time for us. He is the spokesperson for the Department of Health.